thank you so much for the opportunity which I've been given to try and discuss about the implementation and scaling up of HIV self-testing in Zimbabwe. As you might be aware, I think I presented this yesterday, where I'm looking at where are we in Zimbabwe in connection with the first 90. As you know, all of us, we have to contribute to the 390s, the fast-track targets for 2020, and we need to add AIDS by 2030. So if you look at the Zimbabwe Demographic Health Survey for 2015, it actually indicated that males between 15 to 49 years, 62% reported that they have actually been tested for HIV. And for females, it was about 77%. They reported that they've been tested for HIV and they know their status. But if you look at the overall, I think there is really more to be done so that we are able to reach our first 90. Looking again at this Zimbabwe population HIV impact assessment, which was done again last year, looking at our progress towards the first 90, the second 90, and the third 90. We are at 74% as a country on the first 90, identifying those who are positive, and then we are at 87% to those who are actually on treatment. And viral suppression, we are up at 86%. But disaggregating the data into different age groups, we have realized that when we look at our different age groups, we still need to do more on the 15 to 24 years old. Only half of them, they reported that they know their status, and we still need to do, like if you look at the women between the ages of 15 to 24 years, 42% reported that they are aware of their status, and then for men, only 26% between the ages of 15 to 24, in that given year, they actually reported that they knew their status. So again, to say what is it that we should do to actually achieve the first 90? As I have already alluded to, Zimbabwe is one of the countries which is piloting the STAR project, which is piloting HIV self-testing. Mathematical modeling was done by Andrew Phillips and Valentina. They actually said if we maintain our testing rates, which are already high in Zimbabwe, but if we put it as business as usual, we will never reach the first 90 by 2020. But if there is additional testing services, like if we are looking at introduction of targeted community-based HIV testing, HIV self-testing, especially to young people, as you had already seen in our gap, our young people were not testing, many of them, and even our men, not many of them are being tested. Even our key populations, our female sex workers, not many of them. But if you additionally put that, the mathematical modeling indicated that by 2019 as a country, we will actually be able to reach the first 90. But if we don't have those additional strategies for HIV testing, like self-testing, we will never reach the first 90. And as you can see, it's actually the last mile, yet we've gone this far, but without putting other innovative strategies, we will never reach the first 90. So what have we done in Zimbabwe? Like I've already said, we are piloting the STAR project, and with that, 2 years ago as a country, we actually started to have technical working groups discussing on self-testing, how we should roll it out in that pilot manner. So we actually looked at how best it can be distributed. We looked at community-based distributors, and 4% of our wards in the country, they was the ones which were selected to actually distribute self-testing. And within that community-based distribution, we even looked at our New Start centers. Our New Start centers are actually supported by PSI, where is our non-governmental organization providing HIV testing in the country. And we looked at that we can still do self-testing within the New Start centers. And then the secondary distribution, which people were talking about right now this morning, where we are saying for partner tracing as well, we have discussed as a country that we have to introduce HIV self-testing for partner tracing as well. And even for our VMMC clients, as you know, one of the barriers when you look at VMMC, for men to come for VMMC because they are of nervous disposition, they are afraid of an HIV test. So then we said, how about if we introduce HIV self-testing for our men? And you have actually seen the results that it has actually paid dividends when we introduce self-testing within our VMMC centers. And we've got distributed distribution points within our sex worker program. We've got a national sex worker program where we've actually introduced HIV self-testings within. And then within our community-based distributors, what they do house-to-house distribution of self-test kits, and we are distributing it to the 16 years and above. And this is in accordance to our national HIV testing consent for those which are supposed to be consenting for testing. So it's 16 years and above. These CBDs, they just don't distribute the test kits, but they provide, again, information on the use of the test kits. They even do a bit of pre-test information giving to the communities who are actually saying they need the pre-test, the HIV self-test kits. They collect their data. I know there's a lot which we need to look at when we look at the monitoring and evaluation of HIV self-test kits. But these community-based distributors who are trained for 3 days before they start their work, they actually enter their data electronically because they need to enter demographic data as well. Then, because it's a research study, these self-test kits, they are actually advised, the self-testers, they are actually advised to return their test kits to a logged Dropbox, which can either be found at a health facility or at a local business center. And then, because it's still a research, there is late read of these test kits to estimate the positivity rate. So what we have seen, the self-testers, they actually use the test kits, and the return rate is about 68 to 70% for the areas where we've actually distributed these test kits. And these community-based distributors, they inform the people that if they test positive, they need to go to a nearest health facility or maybe go to a nearest testing center within that area. And then those who test positive, they go to a health facility and they are tested again, and then to confirm the positive result. So far, our community-based distributors in those 44 wards, they've distributed about 80,000 self-test kits. At first, we thought maybe people were not going to take these self-test kits, but we were actually surprised when, we give them a period to say maybe by 6 weeks, you should have distributed so many self-test kits. But in one district, we realized that we're distributing the self-test kits. In less than 4 weeks, all the test kits have actually been distributed, yet they were supposed to distribute them within 6 weeks. And then we've realized on the evaluation of the data which you get, 23% are the first-time testers, which means they are actually the young men and the men who are not coming for testing who are actually coming. And 44% of them are actually men. And then 43% are from the age group 16 to 24 years old. And then again, when the distributor is distributing the HIV self-test kits, some people will say, okay, I've understood, because they even show a demonstration video, which I'll show it to you later on. They actually say, okay, I've realized, I've grasped what I'm supposed to be doing. I don't need your assistant. So in Zimbabwe, we've actually realized that 73% of the self-testers test on their own. They are not assisted by the community-based distributors. And these are some of the results from the pilot study where, as you can see, 16 to 24 years old, they are actually accepting the HIV self-test kits. More men are actually coming. And then if you look at the positivity rate and the negative, those who test positive and those who test negative, the positivity rate is actually mimics whatever is the positivity rate within the country, even with self-testing. And then the integration of services, like we've said, maybe first year we're using the community-based distributors, but now within the second year we are saying, let's integrate the HIV self-testing within facility-based in Zimbabwe. We've already seen the NGOs within their facilities, they've already actually integrated. And we are looking at a point where even within public health institutions, we will actually be integrating self-testings. And so these are the results for those, when you get into a facility facility-based, you are actually asked whether you want to test yourself or you want to be tested by a provider. Fair and fine, most people, they will be tested by providers, and if you look at what is happening, maybe those who are tested by providers, because maybe they will already be sort of like ill, then they really say, no, let me be tested. They are afraid of actually testing themselves. But there are even those who are actually saying, I will take the self-testing, and maybe there are those who are, we call the worried well before they will grab the HIV self-testing. But what we can even see from these results, we have seen a percentage of more men actually getting the HIV self-test kits, even if they come to those institutions. I've already talked about our VMMC models that we are actually distributing HIV self-testing kits, and we are using our mobilizers. And we've realized that when we introduced this in November, starting in November last year, our males, they are actually testing themselves, and then they later on, after testing and they found that they are negative, they actually go for the voluntary medical male circumcision. And then what are the plans for Zimbabwe on the HIV self-testing? We are leading, the Ministry of Health is actually leading, is actually the ones who are looking at the technical working group involving everyone in HIV self-testing. And in December 2016, we actually launched the WHO normative guidance on HIV self-testing. And our STAR project is still with us until 2019, and we are planning for implementation and securing the resources. And within our dreams, I hope most of our countries here, they are actually dreams project countries. And within our dreams as well, for our adolescent girls and young women and men as well, we've actually introduced HIV self-testing. Plans are underway to scale up HIV self-testing beyond the STAR project. And we've just submitted our Global Fund proposal. We've included self-testing kits within our Global Fund. And although it was on the above allocation, we are hoping that we will get something so that we scale up the self-testing. In summary, HIV testing is reaching population groups, especially men and youth. The yield is actually can be achieved for us to reach the undiagnosed. And if integrated within our health institutions, we are actually looking at increasing efficiencies of services. And Ministry of Health has actually taken HIV self-testing as part of their policy, and is actually a policy which has been circulated to all the health institutions. I will play you a short video. I don't know how many minutes I'm left with, but this video is 2 minutes. How to use the HIV self-test.
Hello, this is a video that shows how to test yourself for HIV using OraQuick. This test uses a sample collected from swabbing your gums and has been shown to be effective and safe. This video is a step-by-step process and follows the instructions provided with the test kit. If you are HIV positive and on ARVs, this test can sometimes give a false negative result. Do not use if you are HIV positive and are on ARVs. You can ring the toll-free number 08080117 if you have questions about the test procedure or if you would like to discuss your result. Do not eat or drink for 15 minutes before you self-test. To do the test, you will need a private space, good lighting, a flat surface, and something to tell the time. Take out the instructions, test kit packet, and stand from the box. Your test kit packet has 2 pouches. First, open the pouch containing the small plastic bottle. The bottle contains liquid. Open the bottle by flipping open the cap. Carefully slide the opened bottle into the hole in the stand, taking care not to spill the liquid in the bottle. Now, open the other pouch and take out the test device. Do not touch the flat pad when removing the test device. Use the handle instead. The same pouch will contain a desiccant packet. Throw this away as it is not needed for the test. Holding the handle, use the flat pad to swab your upper and lower gum 1 time around each gum. Immediately place the flat pad into the open bottle until it touches the bottom of the bottle and note the time. Leave the test device in the bottle for 20 minutes. It's now time to interpret your results. Make sure to read your results in an area with good lighting. If you see 2 red lines, it means the test is HIV positive, even if one of the lines is faint. If the test is positive, it means you may have HIV and you need to do a second test to confirm this result. Visit your nearest HIV testing center or health facility as soon as possible for confirmatory testing. If you see 1 line, it means the test is HIV negative. Seek regular testing if you are exposed to HIV. If you are HIV negative, you should continue to be careful to protect yourself against HIV. Minimize your number of sexual partners. Use condoms and consider male circumcision. If you do not see any lines, then the test did not work properly. Visit your nearest HIV testing center or health facility to test again. You have come to the end of the testing process. Please place the used testing pad in the envelope supplied to you and drop it in the collection box with your CBDA or at the New Start outreach. Put the rest of the kit contents in the outer packet and dispose in a bin or blade toilet.
Okay, that's the end of the video, which we actually use when our community-based distributors are talking about self-testing. And before that, we actually developed videos both in our local languages, and there's actually literacy, some IEC materials which we developed. And we actually sensitized even our communities before we had our community-based distributors, and we sensitized our local leadership so they were aware of this HIV self-testing and all that. I would like to thank you for listening. And as you know, I think self-testing is the way to go. Gone are the days when you will sit in that room and being castled for a lot of time, and then you are told to come for 2 weeks for your results. You would have died so many times before your deaths, before those results. But now you can get the results in 20 minutes. Thank you.